Hello everyone, myself Preeti Sharma, Assistant Professor in RKGIT, Ghaziabad. So, today I will discuss the general principle of prevention and the control of Chickungunya, Dengue and Filariasis. So, I will discuss here the prevention and the control of these three diseases, Chickungunya, Dengue and Filariasis. So, everybody knows what is Chickungunya. Chickungunya is a virus that is spread by mosquito. It can be passed from person to person, and it has been seen in many of the 16 countries in Asia and Europe, Africa and the America, but Chickungunya is rare in the US, means in the United States we have seen very rare cases of the Chickungunya, and only 175 cases has been reported here since 2016, and you can see Chickungunya is a mosquito borne viral disease transmitted in human by an alpha virus that is spread by the infected Aedes aegypti and Aedes albopictus, and causes of the Chickungunya virus is basically it is a member of alpha virus. It belongs to a family of Togaviridae family, and it was first isolated in 1953 in Tanzania. It is a RNA virus. So, you can see here the man mosquito and man, the life cycle, how it goes. The cycle of infection means from man to mosquito and mosquito to man. It is a borne viral disease transmitted in humans by alpha virus. It is basically transmitted by alpha virus that is spread by the infected Aedes aegypti and Aedes albopictus. Now, the next is diagnosis. Laboratory diagnosis is generally accomplished by testing serum or plasma to detect the virus, and viral nucleic acid or virus specific immunoglobulin and neutralizing antibodies. Viral culture may detect virus in the first 3 days of illness. However, Chickungunya virus should be handled under biosafety level, and biosafety BSL, we can denote it from the BSL. During the first 8 days of illness, Chickungunya, as I told you, it is a RNA virus. Viral RNA can be often identified in the serum, and Chickungunya virus antibodies normally develop towards at the end of the first week of illness. You can see or you can develop the antibodies normally in the first week of illness. Therefore, to definitely rule out this diagnosis, we are sampling out the serum, we are sampling out this serum, or we are identifying the acquired phase sample that must be test negative. You can prevent measures seeking protection from Chickungunya. There is transmission, it can transmit, it is mostly transmitted to humans through the bite of an infected mosquito of Aedes genes. Genus of Aedes aegypti and Aedes albopictus, it is a genus of Aedes, basically Chickungunya, and it is transmitted to humans through the bite of infected mosquitoes. And the sign and symptoms, you can see the high fever, joint pain, rashes, headache, nausea and fatigue. These are some sign and symptoms. Now, the preventive measures seeking the protection from Chickungunya. There is no vaccine or preventive drug for Chickungunya. So, the best way to avoid infection is to prevent mosquito bite. First of all, there is no vaccine and no drug to avoid this infection or treat this infection. So, basically we have to prevent it by preventing the mosquito bite, but there is a potential vaccine being evaluated in clinical testing Basic precaution should be taken by people during the traveling to high risk areas. Means if the people is traveling to a risky area, then it should be some precautions should be taken. Wearing the long sleeves, long pants and other clothing that minimize the skin exposure. Means the person have to wear the long sleeve, long pants and other clothings that will minimize the skin exposure. Means if the skin exposure is reduced, then there will be a prevention, we can prevent the mosquito bite. Ultimately it will prevent the malaria, causing of malaria. Using the insect repellent on skin or clothing, and the basic precaution should be taken by people traveling to high risk areas, include wearing, I told you that long sleeves and long pants should be used. Using the insect repellent on skin or clothing, make sure that indoor spaces have adequate screen to keep the mosquito out, and using the insecticide treated mosquito nets over your bed if you sleep in the daytime. And here wearing mosquito netting over your face and neck, in addition to using gloves and the repellents. If you spend a lot of time outdoors in areas with mosquito, avoiding travel to areas expressing a chikungunya outbreak. Use the mosquito coils, or we can see the mosquito creams that will prevent the mosquito bites, and the insecticide vaporizers during the daytime. There is now how chikungunya can be prevented. There is neither chikungunya virus vaccine for nor the drugs are available to cure the infection. Preventive centers on avoiding the mosquito bites, but there is some preventive or we can say there is some centers on avoiding the mosquito bites. Eliminating the mosquito breeding site is another key for preventing this malaria. Now, to prevent mosquito bites, to do the following: use mosquito repellents on skin and clothing. Now, here we have to main focus we have to give on the mosquito bite, means to prevent the mosquito bite. Eliminate the mosquito breeding site is another key. And these are some, because there is no specific antiviral drug and no commercial vaccine is available till date. And control mosquito population by limiting their habitat. Use the insecticide, use insect repellents, wear the bite proof jackets or long sleeves and long pants. Screen by using or securing the screen or windows and closing the doors. These are some preventive measure that you have to remember all these points. Now, the next one is dengue. Next topic is dengue. So, I will discuss here what is dengue and what are the prevention and control method of the dengue. Historical background. Dengue epidemic are known to have occurred over the last 3 centuries in tropical, subtropical and temperature zones. The first epidemic of dengue was recorded in 1635 in the French West Indies. Rush described about the breakbone fever occurred in Philadelphia in 1718. So, this dengue, basically the first recorded outbreak of dengue was occurred in Australia in 1897. We have seen this first case of this dengue is in the 1897. Similar disease was found in the Greece in 1928, and dengue basically transmitted by the infected female female mosquito, primarily at daytime feeder, lives around the human habitat adaptations, and it lay the eggs and produce larvae. Preferentially in the artificial containers, it lay the egg and produce the larva. Disease is it is also known as the yellow fever, and first confirmed epidemic of dengue fever means dengue, DHF means dengue hemorrhagic fever, was recorded in Philippines in 1953 and 54, and here no prevalent in India, Indonesia, Myanmar, Sri Lanka, new countries of West Pacific regions. Now, these are some agents of dengue. Dengue is caused by a virus membrane of the genus Flavivirus, and the family belongs to Flaviviridia. Virus is 15 nanometer in size and contains single strand RNA. There is 4 serotypes of the virus, Den 1, Den 2, Den 3 and Den 4. This is a short lived cross immunity between these species. These are the 4 serotype of the virus, Den 1, Den 2, Den 3 and Den 4. These are the agents, or we can say the 4 serotypes of the dengue. Now, these are the vectors. Aedes aegypti is an important vector, but has geographical limitations. Other species of Aedes is Aedes albopictus, and these are some examples here given for the Aedes species, and the most potent vector having epidemic we can say the potential is Aedes aegypti. Habits and the habitat of the vector. Aedes tigris mosquito in India, Aedes aegypti, and these are found in in various other countries. And habitat of the vector: clean water breeder, daytime biter and mosquito breeder. As I told you, it lay the eggs, or dengue transmit infected female mosquitoes primarily at the daytime. Biter and mosquito breeder responsible for the transmission of dengue fever and dengue hemorrhagic fever and dengue shock syndrome. Host: dengue virus infects human and other lower primates. Humans are main urban reservoirs of the disease. Studies conducted in Africa and Malaysia show that monkeys are infected and can be reservoirs of the disease. Now, this is a transmission cycle, how the dengue is transmitted. DHF means extrinsic incubation period 8 to 10 days, intrinsic incubation period is 3 to 14 days, an average of 4 to 7 days. Cyclic nature of the disease: in endemic countries, the cycle can be repeated at yearly intervals. India is an endemic country for dengue fever. Means transmission, or we can say incubation period for the extrinsic and intrinsic is different, 8 to 10 days for the extrinsic, and for the intrinsic is 3 to 14 days, and average it is 4 to 7 days. Now, these are some of the characteristics of the disease. It is caused by a virus called Flavivirus, and the virus get access to human body by the bite of infected mosquito, and it causes 3 type of clinical manifestation: dengue fever, high grade fever and joint pain. DHF means dengue hemorrhagic fever caused by the cutaneous hemorrhage and the platelet depletions. Some of the virus transmitted, these are the factor responsible for the resurgence of dengue. Unprecedented population growth, or means there will be an increase in the population growth, unplanned and uncontrolled urbanization, increased distribution and vector density, inadequate waste management and water supply, development of hyperdemicity and inadequate health infrastructure. Now, before going to the prevention and control, I will tell you the virus, basically dengue virus transmitted to human in mosquito saliva, and this virus replicates in target organs, and after replicating into the target organs it will infect the WBCs, means white blood cells, and the lymphatic tissues, and virus released and circulates into the blood stream. Then ultimately second mosquito if ingests the virus in from the blood or with the blood, it will replicates in the mosquito midgut and organ, infect the salivary glands, and virus replicates in the salivary gland. Ultimately the virus will I will not go to the again to this life cycle, but I will tell you what are the prevention and control. Sign and symptoms, you can see the seizure, there will be a confusion, person will feel tiredness and go to a coma stage, low platelet count in the dengue. Now, the treatment, how we can treat and prevent this chikungunya. Eliminating of breeding places of mosquito, avoidance of man mosquito virus contact, drinking water storage containers are to be drained at the interval of 3 to 4 days, proper cleaning of overheaded water storage tank, never leave the tanks uncovered, coolers and should be dry and kept aside, use the bottles and containers should be disposed of properly. Personal protection should be taken, use of mosquito net, repellent creams, mosquito coils, mat and aerosols, and the medical measures, passive surveillance and active surveillance. And these are some of the early diagnosis and treatment of cases. Now, next come to the national or the Filariasis control program in India. How we can control, what is filariasis and what are the prevention and control of this filariasis. Filariasis is a parasitic disease caused by an infection with roundworms of filarial, and they are spread by the blood feeding black flies and the mosquitoes. This disease, filariasis disease, belongs to the group of disease called helminthiasis. Now, filariasis is caused by a several round coiled thread like parasitic worm belonging to a family Filaria. This parasite, after getting deposit in the skin, penetrate onto their on and through the opening created by the mosquito bite reaches the lymphatic system. This will move through this hole that is created by the mosquito bite, and it will enter into the systemic circulations, this parasitic worm, and this disease is caused by the nematoid worm either by the Wucheria bancrofti and Brugai melli, and Brugan filariasis swollen and painful lymph nodes episodically, most commonly affecting the lymph node at a time, and the infection lasts for several days and usually heals spontaneously, and the frequency of episode may vary from 1 to 2 attacks per year to several attacks per month. Sometimes this or we can say the affected lymph node is followed by the retrograde lymphatitis, and we can say the infection may spread to the surrounding tissues and occasionally involves the whole thigh or entire limb. The infected lymph node may become very ulcerating and fibrotic, scarring. Now, this is some vectors how this Wucheria bancrofti in the mainland, and breeds in association with human habitat is the domestic pest mosquito, preferring polluted waters such as sewage and water collection including pools and pits, drains by the septic tanks. The eggs are laid, means they will lay the eggs in rafts containing 150 to 40 eggs each depending on quality and quantity of the blood meal taken. At the optimal temperature of 250 degrees Celsius to 300 degrees Celsius, the egg hatch within 24 to 48 hours. Now, this is a life cycle of filarial parasite. In the first stage, Wuchereria bancrofti will move into the adults in lymphocytes, and this Aedes will produce outshot, means whole Wuchereria bancrofti will move into the lymph nodes and will affect the lymph nodes. Ultimately, after entering, it will convert into the larva by laying the egg, L1 and L3 larval stage. Now, I will come to the preventive and control measure of this filarial disease. National Filarial Control Program, NFCP. After a pilot project in Orissa from 1949 to 1954, the National Filarial Control Program was launched in the country in 1955 with the objective of delimiting the program to undertake the control measures. The main control measure is diethyl carbazine, that you can see here, DEC. If a person used the diethyl carbazine with the combination of albendazole, then it will prevent the filariasis. Means DEC plus albendazole is more effective as compared to that of albendazole single. If a person is taking a single a dose of albendazole, it is less effective as compared to in combination we are giving the DEC plus albendazole, means diethyl carbamazepine. Recurrent anti-larval measures at weekly intervals. Environmental methods including the source reduction by filling the ditches, pits, low-lying areas. Biological control of mosquito breeding through the fishes, and anti-parasitic measures through detection and treatment of microfilaria, carriers and a diseased person with DEC by filarial clinical can see in the town and covered with the programs. These are some national goals. The national health policies in 2002 aims for eliminating of lymphatic filariasis by 2015. The strategy for achieving the goal of elimination is biannual mass drug administration of antifilarial DEC plus albendazole for 5 years or more to the population, excluding children below 2 years and pregnant women and seriously ill person in affected areas to interrupt the transmission of disease. Next, I come to the MDA, means mass drug administration of single dose of DEC was launched in national, means NFDA, National Filarial Day, on 5th June 2004, means on we are celebrating the National Filarial Day or launched the Filarial Day on the 5th June 2004. It considered as a Filarial Day by the Ramados Honorable Union Minister for Health and Family Welfare in Maharashtra, District Maharashtra. Srimati P. Lakshmi, Honorable Union Minister of State for Health and Family Welfare, initiated the mass drug administration, means for the single dose of diethyl carbamazepine, it was recommended, or we can recommend to the mass patients drug administration. Mass means we are giving to a large number of populations. More people, if you are administered with the DEC, it was launched, means diethyl carbamazepine is taken by the people to prevent the this filarial. Then there will be initiated the MDA in the Raebareli district in UP, and we can see here some of the national goals as I told you. That DEC plus albendazole is for 5 years means strategy for achieving the goal of elimination this means we have to focus for the prevention and control DEC plus albendazole for 4 years or more to the population, excluding children's below 2 years, pregnant women and seriously ill persons in affected areas to interrupt the transmission of disease. Means these are some of the goals MDA are here, means effective dose is given here by the albendazole, diethylcarbamazepine and single albendazole. MDA 2004 as I discussed here, these are some references and the review papers. So, you can note down these review papers. Thank you for your patience.